Code of Ethics. International Council of Nurses first adopted the Code of Ethics in 1953 and then revised in 2012. So here we are going to discuss the latest one. There are four basic elements in Code of Ethics as per ICN. What are those? These are nurses and people, nurses and practice, nurses and profession, nurses and co-workers. Now we will discuss them one by one. First is nurses and people. Here people means our client to whom we are providing nursing care. The nurse's primary professional responsibility is towards the people, towards the client, or we can say towards the patient. But nowadays we call client. In providing care, the nurse promotes the environment in which human rights, values, customs, and spiritual beliefs of an individual, family, and community are respected. The nurse keeps personal information secret and uses judgment in sharing the information. We should understand the person as an individual and unique. The nurse advocates for equity, social justice in resource allocation, access to health care, and other socio-economic service. Every person or every client should feel wanted during nursing care. While providing care, the nurse provides sufficient information to permit informed consent to nursing, medical care, and we should also respect the right to choose or refuse the treatment. So these code of ethics also help us as well as also help the client. The nurses use recordings and information management system that ensures confidentiality and also adopt and monitor environmental safety in the workplace so that the client feels safe, secure in the hands of nurses. Second point comes nurses and the practice. The nurse carries primary responsibility and accountability for the nursing practice. What we are doing, we are responsible for that. The nurses maintain a standard of practice as well as standard of personal care, personal health that shows the ability that makes the nurse able to provide care that is not compromised. The nurse ensures that she uses the technology and scientific advances that are compatible to maintain the standard of practice. The nurse always work for maintaining competence by continual learning so that we can provide perfect care to the client and justice with our practice. The nurse should establish a system for professional appraisal, continual education, and systemic renewal of licensure to practice. That's why in many countries there are specific periods for license. For example, in India it is 5 years. After every 5 years we need renewal of licensure and it needs continual education, some hours for refresh courses. The nurses should maintain standard of care and a work setting that promote quality of care while taking care of own health. Because when we are healthy, we can provide much better care to the client. Next is nurses and the profession. Profession that we are doing, the care, nursing profession. The nurses are always active in developing and sustaining a core of professional values. The nurse acting through the professional organizations participate in creating a positive practice environment, good working condition, maintaining safe and equitable social and economic working condition in the nursing field. The nurses always work for self as well as for professional growth and contribute to an ethical organizational environment. The nurses set standards for nursing practice through research, education, and management of growth of nursing profession. They work for growth of nursing profession. The nurses also promote participation in national nurses organizations so as to create favorable socio-economic conditions for nurses. Next is nurses and co-workers. As you all know that the setting where the nurses are practicing, it requires a lot of manpower. So many health professionals are working with the nurse. The nurse sustains a collaborative and respectful relationship with co-workers in nursing as well as in other fields. The nurse take appropriate action to safeguard individual, family and communities when their health is endangered by a co-worker or by any other person. So means our main central focus is client safety, client care. The nurse take appropriate action to support and guide co-workers to advance ethical conduct. The nurse creates an environment of specific and overlapping functions and potential for interdisciplinary tensions and create strategy for conflict management. Many times we see that there may be conflicts among healthcare workers, but it is the nurse who always try to sort out the things. The nurse develop a workplace system that support common professional ethical values and behavior. She or he always work as a team with co-workers.
My student support system. Keep watching, keep learning.